the Director of Community Initiatives at the Seattle Chinatown ID Preservation and Development Authority. We are a 45-year-old community development institution in the Chinatown ID. We do affordable housing development and management. So we own and manage, we own about 4 buildings in the district, but manage a total of 9, all of which are low income. We also support senior care and senior services in the district. And then we have a outward facing arm of the community or of the organization that specifically serves small businesses, residents, visitors, does work around public space, work with property owners, local ownership, and then public safety in the CID.
You cover a lot of bases there.
Yes, we do.
And then, so I'm sure that this most unusual time of COVID-19 has hit SCIDPDA particularly hard. Can you talk a little bit about that?
Yeah, so I think it really has had to, made us realize how much we do in terms of essential services in the district. So like I said, we own/manage around 9 properties in the district, 8 of which are mixed use. Well, they're all mixed use buildings in that they have commercial on the ground floor and residential on top. Our 9th building is the building that inhabits International Community Health Services and Legacy House, which is all managed by ICHS. So we're more just maintenance there, but the rest of our buildings, we house, I think actually the actual number is 767 folks, people, which ranges from seniors all the way to children. So really trying to be available and a resource to our residents. So we've increased cleanings in our buildings. We've done wellness checks with all of our residents. We actually had to do many of those over the phone, and that actually ended up working out quite well, surprisingly. And for those that we did not were not able to reach via phone, our building managers who are still working had to go in and do checks, because what we did not want to do was to have somebody that was ill in their building and unable to reach someone. So we're doing that. The other issue that we're noticing is food security issues with our residents. Many of them are low income, and so they either access the food bank, whether it be a food bank in the neighborhood, which is underneath I-5, or other food banks that might be suffering from the loss of volunteers and things like that. And then many of them access free meals. So whether it was through school for the kids or through the meal programs for the seniors, some of those those obviously have stopped. The meal programs for the kids or the seniors have stopped. So one of the things that we're doing in addition to our wellness checks is delivering bags of groceries to our residents. And so that's close to almost 400 households that we were delivering to. We've collaborating with some other nonprofits to kind of share the load on that, but we do that once a week. We're also looking into getting meals delivered, like hot meals, and so that's still in the kind of development process. So it's really just trying to like gather volunteers, coordinate everything, and then get it to our housing projects. And then just to kind of outline, we have custodial staff, maintenance, and building managers that are still working. And so kind of, making sure they have the proper equipment, gloves, masks, to make sure that they're continuing to do their job safely, because they're essential services and they're needed in order to serve our community. And so really being focused on that. My department is our external facing part of the organization. So we work with the community, with business owners, with residents, with visitors. And so in a normal time, a lot of our work involves, working on public space, working with the parks, thinking about how to work with small businesses, helping them grow, helping them, do work. During this time, some of the more non-essential work has stopped. So thinking about how to reinvent Hinghey Park is really not a thing right now. Yeah. But one of the things that we're really focusing on pretty heavily is our support for small businesses. So it's really kind of taken over in terms of my workload as well as some of my team. I have actually loaned out, quote unquote, loaned out some of my team to support property operations and the food delivery stuff. And then the rest of us are really focusing pretty closely on our business relief work that we're doing. So that includes a business relief fund that we've started to give direct money to small businesses in the CID, as well as getting the resources that they might need to know about what's happening when the governor puts out an order and what regulation, restrictions come down, what's available for unemployment, what's available for tax deferment, legally, about how the mayor put a ban on evictions, things like that. We try to get that information out to small businesses, and really just the support is pouring in, but like, how do we let businesses know about different grants that they can apply for and things like that. So that's really what we're focusing on right now. It's definitely been interesting as we're collaborating very closely with our partners at the business improvement, the CIDPDA, the business improvement area, and the Friends of Little Saigon, and to have 7 people try to get on, have a conversation about something when we're all doing it remotely has been really fun. Yeah. But it's been really also refreshing to know that, we can work together and we can do it in unprecedented circumstances, and that's been really nice.
Yeah. Can you talk a little bit about the relief fund and distribution of that? I've heard a lot of how successful it's been with people stepping up and contributing to the fund. What do next steps look like?
Yeah, so the fund was actually a big surprise for us. So what's interesting is that what a lot of people think I don't think is that we have a restriction in the state of Washington around public money for private gains. So the city of Seattle cannot give directly to a small business to support them without kind of strings attached. So there's like this fund coming from the city of Seattle right now, that's the stabilization fund, and it has some like strings attached kind of in how you can give them money. So that's why when you have a private donor that gives you money, you can private money is the best because it has very little restrictions on it, little to no restrictions. It's usually restrictions, if there are on it, is put on by the donor. So we got a call from Vulcan about almost 3 weeks ago, I think at this point. It'll be 3 weeks on Friday. The Vulcan, whose headquarters is just along 5th Avenue, right in the neighborhood, they wanted to donate $100,000 to small businesses in the CID, and they wanted us to help get it out. And so we had a really great conversation with the folks at Vulcan and kind of our team, our business, what we've now called ourselves the CID Small Business Relief Team. There's literally 7 of us on it. And we decided that we were going to use that as seed money to see if we could because at that point I would start getting contact from people like, are you going to start a relief fund? And we were like, well, we don't really know. We don't know how much we could raise, how impactful it could be. But once you have a seed of $100,000, we were like, well, we're starting out with $100,000, and that means we could, try to gain more momentum. And so we released the business relief fund about 2 weeks ago. We've raised almost this morning, I think we were up to $57,000. So that's a total of $157,000. We made it very clear from the beginning, we decided that we were going to start with restaurants because those restaurants in the CID were some of the earliest hit, as early as late January from the impacts of this. Sorry, there's a loud bus right outside my door, or a truck or something. It's making squeaky noises. Because the restaurants were kind of hit first and the hardest in the beginning, really honestly, because of, racism and xenophobia around specifically Chinese-owned businesses. And so we made that decision when we knew that the restaurants were getting hurt the most. As time has gone on, obviously they're the ones that are still open and doing takeout at this point. But we're going to stick to what we had decided with the restaurants because they've seen the longest impact. And so we're actually going to be contacting restaurants starting tomorrow that have been awarded the fund. We are doing a blanket award to all restaurants in the CID that fall under certain criteria. So physically located in the CID, have to be locally owned. So owned by somebody within the Western Washington region, cannot be a corporation. or cannot be a chain. There's other criteria, but I can't remember. We were written down. And so it's coming out to about 120-ish, maybe a little less than that, restaurants. And so we're going to kind of equally award them all an amount of money, and then continue to raise money and hope to do another release of funds later, because we're guessing this will go on for probably at least another month. We're also, going to be hopefully accessing, in addition to continuing to raise money by individual donations, accessing some money from a couple of other resources and other organizations. So we're working on that right now. I can't really talk about that quite yet, but we're hoping that will grow the fund a little bigger. And we want to also be able to support our retailers in the neighborhood. So a lot of the smaller kind of gift shops or shops that are non-food related, we also want to support as well.
Yeah. Thank you for sharing that. That's, I'm sure that's going to be super helpful for other community partners who are trying to grapple with the same issue of the redistribution of these funds. So,
I mean, I'm going to be honest, it's really difficult. $100,000 is a lot of money, but when you have 400 businesses, it's not.
Yeah.
And it's really hard to kind of, I guess, make that decision, which makes me really happy that I'm not normally a grantor of money. And, especially those that a lot of us have personal relationships with these businesses. And so we know that, I think somebody used the analogy of like, if you have all these people in your lives that are drowning, which one do you save first in a way? And, and it's really hard to make that decision, but we do want, we want to know that each business is important to us in the neighborhood. And so want to be able to support all of them.
Yeah. Is there anything that you would like people to know about your organization at this time? I think the thing that I think people need to realize is that what makes this, I hope people realize that once this kind of crisis is over, the amount of time it will take us in a neighborhood like ours to kind of crawl out of it, to get out of the hole that this will create. I am fairly certain that my work plan for this year is out the window. The way I planned in January. we were doing goal setting for this year like in February, and then this all happened and we were like, are we still doing goal setting? Because never mind.
I'm not really sure what's gonna happen. And that, I also kind of laugh because we used to talk about the impacts of the 2008 recession and then like construction impacts and how it really affected the neighborhood. And I was like, we had no idea that something like this could happen, and we'd be totally screwed for a really long time. And so I think organizations like us were really founded to increase the resilience and kind of vibrancy of neighborhoods like the CID that are, mostly POC, mostly immigrant and refugees, mostly low income. And that, unfortunately, times like this is why organizations like ours and International Community Health Services and the Wing Luke and Chinese Information Services and Interim CDA, that's why we're all important, is because we're really there to support the community. So like, I guess my thing would be like, and other organizations across the city that do this work, White Center CDA, El Centro de la Raza, like these organizations are going to be so much more needed after this, and to not kind of forget that once we all personally can go outside and like kind of return back to normal life, that we're going to be probably dealing with the impacts of this crisis for many, many years to follow because of the economic issues it causes, because of, the problems it may have caused for, families and things like that. And so I think just for people to remember that, and that it's not going to be over when it's over, I guess is the best way to say it.
Yeah. What are there any ways that people can support the CID or the work that you all are doing?
Sure. The relief fund would be great. If folks want to give to the relief fund. If people are feeling comfortable and healthy and able, we do need volunteers physically to come and deliver food. We do it every Friday around 11, I think. Obviously, like I personally can't do it because I care for my in-laws, which are elderly, but you know, for folks that are able to and don't have vulnerable folks that they're around, it'd be really helpful to have people come and help deliver food, but to really consider the safety of your family and your kind of your whoever you're around, the safety of your loved ones. But we also, International Community Health Services is also doing testing at their clinic. And so they actually just need people to help kind of like deal with traffic and like cars going this way, cars going that way, because people are being tested in their cars. Mm-hmm. So I think if people are interested in helping out in that way, just to kind of you can give them my contact information and they can email me and I can connect them with the proper people. And then really just kind of supporting the businesses down there, doing takeout and things like that. And when the thing is all over, really coming down to the district and supporting the neighborhood as a whole, I think would be huge. I guess the only other thing I would say is that, you know, there's this conversation happening right now around racism and xenophobia against APIs and an increase of hate crimes. And just, you know, really kind of paying attention to that and like the narrative and the rhetoric around, you know, what our presidents keep saying about it being a Chinese virus or whatever, things like that. I think for people to kind of fight against that and fight against that stigma.
Yeah. Yeah. Do you have any message of hope for people who are tuned into this?
Ooh. We're a resilient community. I think that the CID is a resilient community. I think we will survive this and I'm not sure how we're going to look on the other end of it, but we'll still be there and the people that are doing the work will still be there. And I think that, you know, we as maybe a society need to like listen to the governor and stay home as much as possible. And that I think that the things that are happening now with people's generosity and kind of wanting to support others, I think is something that we need to maintain. Because that's kind of given me hope around humanity and people and seeing all that. So, you know, let's try to maintain that after this is done.
Yeah, we're in this for the long run.
Yeah, and you know, they're saying that it might die over the summer and come back.
Yeah. Oh no.
I know. Maybe don't look at those. I have a coworker that pulls up the map of the like world CDC. I don't know, some kind of like it tracks who's getting how many viruses are you trying. I'm like, maybe don't look at that every day.
Yeah. Yeah, the news in moderation.
Definitely.
Well, thank you so much for your time today. This has been really exciting to hear what's happening and how you all are approaching all of these obstacles. And I'm sure this is going to be super helpful to other folks as well.
Yeah. Thank you very much.
Yeah. So I hope you take care. And
hey, you too.
We look forward to getting back into the community.
Me too.
All right. Have a good one.
Thanks.
Bye.
Bye.